Hello students, let us continue with the session, that is the revision of the unit 1. So next is the concept of wellness. So in the concept of wellness, well-being, it means we can able to express well-being of an individual in different ways, okay, and the several components which is expressing that a person or an individual, he or she is achieving well-being in his life. It means that we have to explain regarding the standard of life, the level of living, and the quality of life. So when the standard of living, level of living, and the quality of life, if these are explained, then the sum total of all this thing is well-being of an individual. So the sum total of standard of living, level of living, and the quality of life is the well-being of an individual. So standards of living. Whenever a person or a family is having good income, occupation, standard of housing pattern is good, sanitation facilities are there, nutrition, adequate nutrition is there, provision for health services, education, recreation, other services, which all, if these all things are there, then we can able to tell that the standard of living of that particular individual or a family is good. So standard of living, we can able to measure the standard of living on the basis of income, occupation, housing, sanitation, nutrition, provision of health, education, recreational activities. And this all things we can call it as the sum total or the collective indicators of the standard of living. Next is level of living. So for the level of living, there are 9 components, and these 9 components are again the health, food consumption, education, occupation, working condition, housing, social security, clothing, recreation, and the leisure, human rights. So these 9 components, they will be influencing the health or the well-being of the human, and these are considered as, if these 9 components are there and if they are in the optimum level, then we can able to consider that the level of living is good of a particular individual. If there is any impairment in the above 9 components, it means that there is an impairment in the level of living. So the 9 components which is measuring the level of living are health, food consumption, education, occupation, working condition of an individual, housing, security, clothing, recreation, and the leisure for human rights. So when this standard of living and the level of living, when they are at the optimum level, we can tell that the quality or well-being of an individual is also there. Next comes to the concept of the disease. So the simplest definition, we can tell that whenever there is a maladjustment, or whenever a person is having is not having the physical, mental, social, or the spiritual well-being, okay, the exact opposite of the health, that is whenever an individual is not possessing the optimum level of physical, mental, social, and spiritual well-being, that is termed as disease. And the concept, it is based on the maladjustment. If health is the adjustment between the human organism and the environment, disease is the maladjustment between the human organism and the environment. That is, there is a deviation from the normal functioning or normal state of well-being. That is the concept of disease. So disease means that it is a maladjustment between the human and the environment, where the human is deviating, the human body function is deviating from the normal, which is not bringing a complete state of physical or mental well-being. That is disease. Next is, what is the distinction between disease, illness, and the sickness? Exactly, disease means it is without ease, okay, dis-ease, without ease. It means that there is something wrong in the body function. Illness, it is referring to the presence of any specific diseases where where the individual is perceiving about the problems in the body, or in his behavior we can able to see the response. That is, he is not feeling ease, he is having some uneasiness. So that presence of uneasiness or the presence of specific disease in the body is illness. And sickness means it is a state of social dysfunction. So that is the difference between disease, illness, sickness. Disease means the person is having something wrong in his body function, by which he is feeling that he is feeling some uneasiness in his body. Illness means in his behavior, or the individual is perceiving that there is a presence of specific disease, or there is a presence of uneasiness inside the body. That is illness. And because of all these problems, if the body is not functioning to a state of the to a well-being state, that is referred to the sickness. So disease, it is a physiological or psychological dysfunction. Illness, it is a subjective state of person who feels aware of not being well. And sickness, it is a state of social dysfunction, which is assuming that an individual is sick or the individual is ill. Coming to the health illness continuum. So health illness continuum, it is measuring the degree of a client's wellness at a particular point of lifetime, from where he can able to achieve the optimum health in one hand, and to the other hand, if he is not having the optimum wellness, it will be leading towards the death. Okay, so that continuum is termed as health illness continuum, which was developed by Newman in the year 1990. So according to the health illness continuum model, health means it is a dynamic state, a changing state where there can be alteration in a person. That alteration, it can be because of the internal and the external environment, which is maintaining or which is not maintaining. If it is a illness which is not maintaining a state of physical, emotional, intellectual, social, developmental and spiritual well-being. Okay, so what is health according to the health illness continuum? Health means it is a changing state which can be continuously altered whenever the person is adapting to the changes of the external environment or the internal environment. Why the person is adapted to the changes? So that he can able to maintain a state of physical, emotional, intellectual and social well-being. Then illness, it means it is a process in which the functioning of a person is diminished. Whenever the individual is not able to function properly, that is termed as illness. So according to health illness continuum, illness means whenever a person is not able to function properly in his lifetime, that is illness. Health means that the person will be adapting to the continuous changes in an environment so that he can able to maintain a state of complete well-being. So if you're seeing this model, see, this is health illness continuum model, where a normal individual, if he is maintaining a good health, he will be attaining the high level of wellness. So this area is the wellness area or the well-being area. So if other hand, if the person is having illness, but when he strives to achieve a good health, he will be going for the health highest level of wellness. But if he is not getting proper services, or if he himself is not taking adequate measures to suppress the illness or a disease, then it will be increasing and he will be going for the maximum death. So this is the health illness continuum. So what are the spectrums of the health? There is a positive health or a better health. There can be a unrecognized sickness in our body, mild sickness, severe sickness, and death. So these are the spectrums of health. So an individual, he or she will be having a positive health or a better health. Sometimes some unrecognized sickness will be there, or mild sickness, even a severe sickness. And if if these three are not treated, then it will be going for the death. The spectrum indicates that the health of a person is not at all a static condition. It is not same always. It will be deteriorating from unrecognized sickness to mild sickness. Mild sickness, if it is treated, it can go for a positive health. So from one spectrum to another spectrum, from one level to another level, it will be deteriorating continuously. And the central concept and the goal of nursing for the health illness continuum, it is, see, the nurses can determine a client's level of health. At any point on the health illness continuum, the nurse will be determining the level of the client's health. And if she understands that the client is having some level of health deterioration, which can be related to any genetic or physiological variables, either she can able to make the client to adapt to the environment, and she can able to make the client to achieve the optimum level of health. But if the client is not identifying the problems, and if the client is not setting the goal, or if the client is not seeking for the help from the healthcare areas, then it will be going towards the death condition. So that is the central concept and goal of nursing practice related to the health illness continuum. Okay. So moving on to our next part, that is concept of prevention, levels of prevention. So prevention, if you're seeing, there are 4 levels of prevention: primordial prevention, primary prevention, secondary prevention, and the tertiary prevention. So primordial prevention, it includes, we are preventing the emergence or development of any risk factor in an individual. Primary prevention means by promoting the health or by protecting an individual from the specific illness, we are improving the health of an individual. Secondary prevention, after the signs and symptoms have occurred, we are doing the diagnosis early, we are giving the treatment for a particular illness, and we are preventing the complications. That is the concept of secondary prevention. Tertiary prevention, it includes disability limitation and the rehabilitation. Let us see in detail. So primordial prevention, we are preventing. Primordial prevention can also be called as a true prevention, by which we are preventing an individual by to get exposed towards all the risk factors. We are preventing an individual from the development of the risk factors. We are discouraging him from the harmful lifestyles. And when we are encouraging an individual to promote the healthy eating habits or healthy lifestyles, then comes the concept of the primordial prevention. So truly we are making an individual to be absent from the disease. We are preventing the individual from the risk factors by discouraging the harmful lifestyles and the harmful eating practices. Coming to the primary prevention. So primary prevention, the pathogenesis phase of a disease is there, but we are taking some actions so that we can able to safeguard the individual before the onset of the diseases. Say example, we are giving immunization, that is before the onset of the diseases, we are taking some actions so that the individual will not be get facing with the problems or facing with the illness. Secondary prevention, it means that we are halting the progress of the disease. The person has attacked by the disease, but we are halting, we are stopping the progress of the disease. How we can able to stop that? By early diagnosing the disease and giving the exact treatment. Tertiary prevention, it means that we are reducing the impairments, we are minimizing the disabilities and sufferings of a particular individual. What are the modes of intervention? How we can able to do this? Primordial prevention, primary prevention, secondary prevention, and the tertiary prevention. So for that, there are 5 modes of interventions. That is health promotion, specific protection, early diagnosis and adequate treatment, disability limitation and rehabilitation. This health promotion and specific protection, this will come in the mode of intervention of the primary prevention. Early diagnosis and adequate treatment will come under the secondary prevention. Disability limitation and rehabilitation will come under the tertiary prevention. So specific protection, if you're seeing the specific protection interventions, it includes immunizing. Okay. When a child is born, we are immunizing the child so that the child should not get exposed to the diseases. Okay. Then protection against occupational hazards, like when we are wearing the PPEs to in a particular area, so that we can able to protect ourselves. We are avoiding the allergens. We are using the specific nutrients so that our immune system and our body will be having the good immune system. So these all will come under the specific protection interventions. Next is early diagnosis and the treatment. So in the early diagnosis, what we are doing, we are see if any person is exposed to a particular illness, or if there is any signs and symptoms, we are doing the diagnostic measurements or the diagnostic evaluation, so that we can come into a conclusion that what type of disease or what type of illness the person is having, and according to the illness we can able to give him the treatment at most early, so that we can able to prevent the further complications. That is early diagnosis and the treatment. Here the disease will be diagnosed, we are treating it in the better form, so that the prognosis and the prevention of occurrence of the diseases can be controlled. Also we can able to control the long term disability. Okay, what are the examples of such diseases? Such as hypertension, cancers, it can be of any cancer. So in such cases, if we are finding the disease in an early stage, and if we are giving them the treatment earlier, the spread of the disease or the increase in the disease prognosis, it can be controlled. Thereby we are preventing the further disability. So disability limitation, which is the intervention coming in the tertiary level. So in the tertiary prevention, here we are avoiding the impairment or the disability in a particular individual. Disease, it can cause an impairment of any system. That impairment will be causing a disability in the functioning of an individual, and disability means it is handicap. Okay, the person cannot able to do anything. So that is the sequence of events which is leading from the disease to the handicap. Disease, it is causing some impairment of any body function that will be disabling an organ to function properly, which is finally causing the handicap. So we in the disability limitation, the objective is to prevent the transition of the disease process from the impairment to the handicap. So you can see an example here. Impairment, that is loss or abnormality of the psychological function or the anatomical function of a particular organ. Whenever a particular organ is not functioning properly, that is restricting an individual to be from the activity which he is doing, like according to his age or according to the sex, what are all the activities he is doing. If an impairment is there that is restricting an individual to do such activities, which we will call it as disability. Handicap means any disadvantages that prevents one from fulfilling his role considered normal. Next is rehabilitation. So rehabilitation means we are using medical, social, educational and the vocational measures. We are combining these measures and we are using it in a coordinative way so that we can train an individual to attain the highest possible level of functional ability in an individual. Okay, so if an individual is having any impairment, we are making use of the medical, social, educational and the vocational measures so that we can able to train the individual in such a way that with the disability or with the impairment, the person can able to achieve the highest possible level of functional ability. So it can be a medical rehabilitation, vocational rehabilitation, social rehabilitation or a psychological rehabilitation. So that is regarding the levels of prevention. So levels of prevention, there are 4 levels of prevention, that is primordial prevention, primary prevention, secondary prevention and the tertiary prevention. Primordial prevention is the true prevention which we are avoiding the risk factors or avoiding the emergence of a disease. That is primary prevention. Primordial prevention. Primary prevention is that we are specifically protecting or promoting the health of an individual. Secondary prevention, in the secondary prevention comes the early diagnosis of a particular disease and we are giving them the adequate treatment so that the further disability can be avoided. Tertiary means we are training or retraining an individual to live his life with the impairment what he or she is having, that is rehabilitation. So in this session we have saw regarding the concept of wellness or well-being, and the wellness of an individual, it will be deteriorating between the health and the death, and that is expressed in the health illness continuum. And also we have saw what are the levels of the prevention and what are the modes of intervention we can able to provide through the levels of prevention services or preventive services. Hope everyone have understood this session. Thank you, students.